and that Southern hospitality, that welcoming feeling you get when you walk into Pitt County.
ECU Health is a level 1 trauma center in Pitt County that covers 31.
Good evening. I'm Kelly Pack-Smith, the chair of the Pitt County Board of Health, and I'd like to welcome you to our May meeting and call our meeting to order at 6:01 p.m. We'll take this opportunity to hear any public comments. Are there any public comments? None. Thank you. I'd like to entertain a motion for the approval of the agenda.
So moved.
And a second. Thank you. It's been moved and properly seconded. Is there any discussion? All those in favor, please indicate by saying aye.
Aye.
Are there any opposed? All right, we have an approved agenda. Let's move on to our items for report. The first report is the Local Child Fatality Prevention Team Annual Report. Vashti Kittrell and Lauren Roach.
Good evening.
Good evening.
I am Vashti Kittrell. I am coordinator of our Women's and Children's Health Education Programs at the Health Department. And I'm back again this year to give our report for the Child Fatality Prevention Team. The information I'm sharing tonight is from the deaths that occurred in 2024. They're always like a year behind. And also joining me is Ms. Lauren Roach. She is our review coordinator, so we'll hear from her in a little bit. So, to start, just to give you a little background or an update as far as our prevention team, back in 2023, the North Carolina General Assembly enacted changes to help strengthen our state child fatality prevention system. There were two key changes that took place. One was to establish an actual state office of child fatality prevention. And then the second one was the creation or incorporating a mandatory review case reporting system. So now we call it the CFP, State Office, and also they make it mandatory for us to input information into this reporting system. So this reporting system, National Fatality Review Case Reporting System, it is hosted by the National Center for Fatality Review and Prevention that's located within the Center of National Prevention Initiatives of the Michigan Public Health Institute. It's also, there is a cooperative agreement that actually manages the National Center for Fatality Review and Prevention. So with this reporting system, it is new, and with it comes issues, a little hiccups. So we are still learning it, still working with it to make it work. So our local team. So the name has been changed because now the Community Child Protection Team, which used to do cases specifically for child abuse and neglect, has now been combined with our Child Fatality Prevention Team. So they combined the two, and it's now just called the local team. And actually, most counties can either have a single team or a multi-county team. Pitt County, we chose to be a single unit because we're big enough to have a single team. The multi-county is basically for smaller counties that they can combine since they don't have as many cases. So the program also receives an agreement addendum. So it provides funding for our team to be able to implement this reporting system and also to be able to support the team in its activities. So who's on our team? The local team is comprised of appointed representatives from public agencies, non-public agencies, and community. So you'll see a list of representatives that we have there. We have been fortunate, most of these are filled, and we're also grateful just this past month we were able to get someone from the school system, which has been vacant for a couple of years. So we're looking forward to having her serve. So our local teams are expected to conduct child fatality reviews. We have to identify gaps and deficiencies that may exist in order to improve the delivery of services to children and families in our county. We also have to make recommendations for changes and carry out those changes that could help prevent future child fatalities. And then finally, we educate communities on how to prevent children from dying in our county. Our local team leaders are Wes Gray, our health director. He serves as the chair. I am the co-chair. And I am so appreciative to have Lauren Roach as the review coordinator. That position has also been vacant for a while, so she has really come aboard and has helped a whole lot. So thank you, Lauren, in front of everybody. So now we're going to talk about our review and the cases. So in 2024, we had 45 child deaths, and the team or our subcommittee chose to review only 14 of those. That is because the majority of those were related to prematurity and or birth defects. So those cases really weren't specifically related to systemic changes. Now I'm going to let Lauren talk about the findings.
So for 2024, we found that the causes of death were unsafe sleep, fewer suicides, motor vehicle accidents, drug use, violence, and exposure to flammable materials. And the Pitt County local team has identified the following recommendations for systemic improvements based on reviews during the 2024 calendar year: more creative ways to educate the population, more creative ways to distribute gun locks and safety boxes, providing mental health first aid trainings in Spanish and Spanish-speaking focus ensures pamphlets are available in schools, provide awareness and education in non-traditional places like the courts, promote crib donation and host an event specifically to give away cribs and pack and plays, and return to the village concept, which utilizes family friends for stress management. The Pitt County local team has identified the following needed resources, to address identified gaps and deficiencies in the existing system: pack and plays, car seats, and more educational and awareness programs, and more grants and funding. All right. Any questions? All right. Great.
Are there any questions?
I have one. You indicated that grant funding was needed. So is there any funding available for those items that are on your list currently, or is everything contingent on a grant?
We have an AA, so they do provide some monies. to be able to offer, for example, we collaborated with the city of Greenville recently for one of their baby showers where we purchased some pack and plays and cribs. What mainly the team is talking about here is when we have our discussions, there are a lot of maybe community-based type programs that will love to do those types of things. Even with DSS, they were sharing also, like when they do home visits, they have to use their money to be able to, buy cribs for families that they see during home visits. So hopefully we'll be collaborating with them some. There's still never enough money to buy as many as we possibly need. The county also funds some of the pack and plays that we have at the health department. So we utilize that funding too. So it's a kind of a mix between what we're offering with our funds, but also other community programs that are existing.
Sometimes we're able to access some gun locks and different types of gun safety equipment from the state DHHS office when they offer it. So every once in a while we'll carry from that. We'll be able to hopefully get some of those.
Thank you.
Any other questions?
Thank
Awesome.
you.
Thank you, ladies. Appreciate that. Next up, Angie Manning, who's going to provide our financial update.
Good evening. Thank you. It's my only one, right? Oh, no, we're doing that one. They have this, right? Perfect. Okay. Good evening. How are you? Okay, so you have a packet in front of you. So this is your financial report closing out the month of April, period 10. We are finishing out the year of 2026. So as we end the month, so our total revenue collection through the end of March is $7,497,241. Year-to-date expenditures through March are $10,719,611. You do see that we are currently, technically by math, running in a deficit of $3,488,602 because we do have the fund balance appropriation of $5.9 million, which will come in at the end. So currently, right now, we're running a little to the good of approximately $1.2 million under that $5.9 million fund balance appropriation at the end of March. Non-essential spending has been cut off at this point, and so we're just right now spending down any remaining grant funds and working on any agreement addendum spending at the state level. So we really probably are going to come in under the $5.9 million fund balance appropriation number for the year. So that is the Excel sheet. I did put together just a physical comparison for you because I know we've kind of talked about a few things for our performance and revenues and expenditures for this year over next year because I wanted to highlight a few things. I broke out the revenues specifically because it's hard to compare revenue, our intake of revenues this year versus last year because the county appropriation has changed. So your first column there, when you're looking at the revenue comparison of the 24 revenues being the 9.9 million versus the 26 revenues of 7.4. The difference in that is your county appropriation revenue. That's not the self-generating revenue. And so that difference of the 2.4, that's the difference in county fund appropriations. The middle column right there, that is all of the self-generating collectible revenues that the health department itself generates. And so to me, that's the more kind of telling number, comparable number of where we are this year to last year. And that difference is only $40,575,000. So roughly with the budget size that we have, we're roughly on target to where we were last year. Expenditure wise, there's a larger difference from 24 to 25. Currently this year we're at $10,719,611, whereas last year we were sitting at $10,201,420, which is a difference of $518,000. So revenue-wise, we're bringing in approximately where we were last year. Expenditure-wise, we're a little different. Some contributing factors to that, we have not received our cost settlement for 24-25 yet, whereas last year we had. Our cost settlement is going to be about $245,000 from Medicaid Direct. Currently, to date, we've received $484,875 in directed payments and 10% holdback settlements for Medicaid Direct cost settlement. So we have received a good amount of that. Our Medicaid Direct cost settlement, we are finding that our direct cost settlement number continues to decrease, but our directed Medicaid payments continue to increase. And that is something that is seen across counties across the state. With the PHPs. Our Medicaid receipt collection, however, we've exceeded the 24-26 totals by 81,589 year to date. And our private insurance, last year we were kind of in the middle of the credentialing. So year to date, we've compared, last year we were at 58,604 this time last year, and currently we were at 133,595. So we're keeping an eye on revenues and holding expenditures tight, except for where grants and physical AAs hold. Any questions? Be glad to answer.
Any questions?
Okay. Thank you so
Thank you.
much.
Angie, don't go too far away. Looks like you and Wes have the budget update next.
Okay.
Good evening, everybody. Last Monday night, the county manager went over her recommended budget for the county as a whole, and then last Tuesday, I presented our health department recommended budget out of that. And proud to say that we are very close on what we proposed and what we are hoping to receive and what was in the recommended budget, and I'll go through that. So again, our health department services are personal health, outreach, health education and health promotions, environmental health, WIC, nutrition, and other services, span a huge breadth of services and a lot of employees and contract staff. And as Angie went over, a lot of different programs, revenue lines, and sources of income coming in to make up the total budget. The major initiatives, as you know, we're looking to expand adult health and primary care services, particularly adding an advanced practice provider position. Expand child health services as part of that, infrastructure and facility maintenance, technology replacement, specifically some computers, and then to maintain and strengthen our current program offerings. So the budget request for this year, we requested $17,347,303. The manager recommended $17,138,904. And the way that breaks down, the source for revenues would be insurance, grants, and other sources in the amount of $3,492,557. That's about 20% of the budget. That's a fifth of the budget. Fees, $266,738. That's 2% of our budget. Federal and state monies coming in, $4,243,342. That's a quarter of our budget. And I'll go over these again, but over the last 2 years, we've been trying to draw down general fund balance dollars to get back to a normal acceptable levels. Both social services and health department have been working on that 2 years ago, and I'll go over these numbers in a minute. We used about $3 million this year, about $6 million, and then this year there's no general funds proposed in the budget, so that's 0%, and then the fund balance would be $9,136,267, or 53% of the budget, total of a little over $17 million. So again, 2 years ago, the fiscal year 24-25 budget, it was $6.3 million in general appropriations, and then $3 million in fund balance. Last year, the current year we're currently in, little over $3 million in general funds, $5.9 million in fund balance. And then again, this year, all the proposed amount is coming from fund balance. Again, the last, from 2019 budget to 2020, 21, 22, 23, 24. It's when we drew the biggest part of our yearly fund balance growth, and the vast bulk of that was lapsed salaries during COVID. Local dollars as a portion of the budget, when we looked at this across the different health departments, Pitt County came in about 45% of our ending totals last year, fiscal year 24-25, came from county dollars, be it a combination of local funds or fund balance. We came in about 45%. So again, this year we're at the proposed level, we're asking for 53. We'll see where we end up at the end of the year, but last year we ended with about 45%. You can see districts are in purple, consolidated counties are in orange, single counties are in green, and Pitt County is right there in blue. You can see we're kind of on the lower end of that spectrum at 45%. These range from a little over 6% to 73% county funds for some of these budgets. These are all 86 health departments. Our expenses, the way the vast bulk of that Pac-Man pie is salaries. So that's $13,453,730 to salaries and fringe, and then $1,745,346 in contracted services. A little bit in operational expenses. That's $1.9 million, and about $36,000 in capital outlay. The revenue side. The vast majority of this, again, is fund balance, at $9,136,267 in fund balance, and then $1,647,502 in Medicaid revenues. Medicare, a little over $5,000 in Medicare expected revenues. MedMax, again, as Andy mentioned, we expect $1.5 million from that, and so that's our cost settlement in the year and the 4 quarterly payments we get from our prepaid health plans and Trillium. And then $184,500 in private fees, so insurance, private insurance. DHHS, state and federal money, that's $4,243,342. Again, that's about a quarter of the budget. Then $266,738 in fees, that's 2% of the budget. A little less than that in other expenses, so $155,405 in revenues, and then $0 in general fund appropriations. And one example of that, we just talked about expanding primary care, and I'll talk about that later in my health report too, but you can see, well, this is an example of a service that we'd like to continue to strengthen in this coming up year. We didn't have this service offered prior to August last year, so you can see we're steadily increasing that with Dr. Simonson and Ashley Jensen, our nurse practitioner. So we'd like to continue that service as well as start primary care services in October. And again, fees, I presented the fees to the commissioners last Tuesday. We have our clinical fees. So with the growth of primary care and child health, we've identified 8 new services along with proposed fees. There were 2 existing fees that we proposed to increase due to the cost of providing services. That was an impacted earwax and a fluoride varnishing fee. Health education fees, one of the things I mentioned was cribs. So we're proposing to eliminate the existing fee for cribs for kids. That was a $10 fee originally designed to encourage client buy-in. Eliminating that fee would create equity with the current Medicaid programs, provide the benefit at no cost, and staff will continue to work with families to determine the true need for services and ensure no one is denied these critical supplies due to financial constraints. We're also proposing the creation of a fee for our birthing class to offset the cost of the instructor, training, and materials to support program sustainability. And then in environmental health, we propose to increase the existing fee for plan reviews for swimming pools to align with the established standard for food and lodging plan reviews and to match the average fee charged by our peer counties. We're proposing to eliminate the fee for existing temporary tattoo permits and the certificate of authorization for mobile home parks. Those practices will be phased out to meet state law and current authorization standards. We've also proposed increases in fees for change of flow permits, change of use permits, and existing system reuse permits to account for the work and staff time required for these permits, which is the same as a new lot evaluation. And I brought up that environmental health, that total program, about 91% of that is funded by county dollars. So straight from the county, about 1% to 2% is supported by fees and less than 2% supported by state dollars. So even with the modest fee increases, it's still around 2% of the total cost for that environmental health program. And then public health fees, we're proposing to establish a fee for the CPR training for healthcare providers to cover the cost to provide the service, and it's comparable to what surrounding offerings of this class are charging. And that is the end of the presentation. I'll be happy to answer any questions about where the revenues are coming from, the expenses, anything like that y'all might have.
Wes, what's the proposed fee for the birthing classes?
$25. $25.
And I'm presuming there is not a Medicaid equivalent, which is why it's not $0 like you're proposing for the,
I believe the $25 is the Medicaid billable rate.
Okay.
It is a Medicaid reimbursable service, and so that is the Medicaid reimbursement.
Got it.
At that, and I believe it's an incremental billable based service.
thank you. Any other questions?
Wes, just so I make sure I understand terminology, on the budget sheet we see every month, it says county appropriations. You use the word general fund. I assume that's equivalent.
Yeah, county appropriation, local appropriation, that's the equivalent on that side. And then the fund balance is the other part we have on that sheet. So this year it would all be on that fund balance side. So you would see a deficit every month until the end of the year, when it's got to be below that $9 million total amount. It's, we'd need to finish the end of the year below that $9 million, and then all the fund balance dollars would come in right at the end. We wouldn't be getting those quarterly payments from the county.
I assume that is to decrease the fund balance to a level that's.
Right. We are not decreasing ours to the right. As fast as we have been budgeting the last few years, has not been going down. The first year we budgeted $3 million, and we only had to use a little over $600,000. And this year we're at we should be having about $1.3 million, potentially probably at the end of the year we don't have to pull down. And so we'll see how we finish up this year, and that'll kind of tell us what next year's going to look like.
To finish my line of questions, so that would, with that change and with that rationale for using that, do any of our services change because of that decrease in county appropriations and use of fund balance for?
I don't anticipate
Okay.
any changes. Yeah, and Janice, the county manager, did have a really good explanation it's on YouTube from last Monday night. But basically, we are trying, social services has done that, and last year has gone down in the limited, used most of their fund balance in their budget last year, or this current year they're in. So we anticipate trying to spend ours down over the next year. We have one additional year than social services to get ours back down to that normal $1 to $2 million buffer.
One other quick question, Wes. So the manager recommended amount for the budget, the difference between what we submitted and what the manager recommended,
Right.
that little over $200,000, what impact does that have?
Sure. So it includes the position for the advanced practice provider. So we have a new headcount position. It does not include what we asked for. We have existing positions right now, a nurse 2 and an interpreter at 0.5 that we asked for to be funded with county dollars. Right now, we had the positions, just no funding attached to them, so we don't have anybody in those roles now. We had asked to fill those with county dollars. And so they're just not filling those 2 positions. So that's the bulk of the difference there, and there's a few tweaks here and there to other smaller line items, but that's the main thing, is those 2 positions didn't make it into the budget.
But again, the positions themselves are still on our books, just not funded
Still
for
on
us
our
to be able to
books.
fill.
Right.
Yep, got it. All right, thank you. Any other questions? All right, thank you. All right, Wes, it's all you.
All right. All right, hello again. I have a brief health director's update report. I wanted to start out with hantavirus. That's in the news lately, and we've since I've done the presentation, they've added a few cases. So officially, we've got 8 cases so far globally and 3 deaths. I think right before this meeting, the last reports were we have 11 total cases. Hantaviruses are a family of viruses that can cause serious illness and death. They can cause diseases like hantavirus pulmonary syndrome, HPS, and hemorrhagic fever with renal syndrome, HFRS. They're mainly spread by rodents. The Andes virus is what we're seeing now. It's typically the only type that spreads person to person. Spreads usually limited to people who have close contact with the ill person. That's the best guess we have right now, close contact, but there was a super spreader event back in 2018 in South America where even short amounts of time with a person caused a lot of spread around there. The Hondius was the ship that we saw these cases originate on. So as of May 8th, the last official update from the World Health Organization and the CDC and DHHS was 8 cases, 6 confirmed and 2 suspected, including 3 deaths. Investigations are ongoing to assess the exposure risk of all American passengers on the ship who may have been exposed and an affected cruise passenger on an aircraft leaving that. So CDC is monitoring the U.S. passengers. There is one North Carolina resident there at the University of Nebraska Medical Center's National Quarantine Unit. 2 are under really close observation. One's in Nebraska and one is in Emory University in Atlanta right now. But definitely something to keep look at over the next few days to see if that does spread. This has a long incubation period. It can symptoms can start anywhere from 1 to 8 weeks after contacted with an infected person. So these people got to be under quarantine for a long amount of time. Fever, fatigue, muscle aches, especially in muscle groups like the thighs, hips, back, and shoulders. About half the patients also have headaches, dizziness, chills, abdominal problems. 4 to 10 days after the initial phase of the illness, late symptoms of HPS appear. Coughing, shortness of breath. Patients might experience tightness in the chest, lungs filled with fluid. It can be very deadly. 38% typically of people who may develop respiratory symptoms may die from the disease. So that's why we're being very, very careful with this outbreak. Moving on to clinic, you can see our numbers from July of 2024 every month. Blue is seen patients, and then orange is how many we scheduled. For fiscal year 25-26, right now, we're averaging 954 visits per month. For the total of last year, for fiscal year 24-25, we averaged 853 visits per month. So we're a little over 100 so far this year, average higher than we saw last year. And I talked about well child checks earlier, expanding child health visits, but just for example, look at new and established well child checks over the last year since we started offering that service last August. So we started with 11 in the first month. That's green is new, and then once they have been seen, they switch over to established patients for any follow-ups. So green has definitely been increasing, and we're also seeing increases in the follow-up cases. So I can see that continuing to grow throughout the next year. Mentioned the ECU Research and Creative Achievement Awards were in April. The Health Department, the clinic got the Anchored and Pirate Partnerships Community Partner Award, and that's Kayla Manning. Riley Truebud was our intern, our student intern. Melissa Daggs and Brittany Kinder were able to go to that ceremony. We had a second case of rabies. We reported this in April the 24th. That followed a few weeks before that. We had a raccoon case, but this was a fox. Fox was found on Hanrahan Road and Highway 11 area. No danger to humans or other animals. The person was evaluated and determined to not need additional follow-up. Rabid raccoon was found in Greenville again about 2 weeks before. For environmental health, through April 26, on-site wastewater, we added 121 site visits in April. 86 sites were evaluated, 667 consultations. New construction authorizations, there were 11 of those. Construction authorizations for repairs, replacement, there was 6, and 22 operation permits were issued. For wells, we evaluated 7 sites. We did 41 consult visits and 6 new permits for wells. For food and lodging, 216 total inspections, over 1,200 consultations for the month, 71 restaurant inspections, 26 food stands, 9 food trucks, 12 lunchrooms, 12 schools, 21 child care centers, 3 residential care homes, 2 hotels, one hospital. I didn't put that on here, but one hospital was added. Rest and nursing homes, we added 2. 28 swimming pools, so that's been ramping up. And then 10 tattoo artists. And then 700 contacts for vector control activities. Speaking of environmental health, Amanda Bennett, she was at the Spring Discovery Fair, so a lot of kids got to see the mosquito abatement management vehicle. For outreach, Healthy Beginnings, we had caseloads of 35 moms, target of 40. Nurse Family Partnership, 67 first-time moms, target of 75. And then Healthy Start, 38 preconception women with target of 46. 89 prenatals with a target of 125. And interconception, 40 with a target of 40. And again, I'm showing February numbers for SimHARP and CMARC because that system has been delayed, hasn't it, Dion? So what the numbers we have were 244 patients for care management for high-risk pregnancies, and then 100 patients for care management for at-risk children. For nutrition, the most recent total, 4,831. So that's 98% of our new baseline, which again was revised mid-year. So our baseline's 4,936. We've got 4,831 in caseload in the most recent report. Outreach events, Spring into Healthy Habits, that was April 18th, and the community baby shower was on May 9th. We have a WITN ad campaign now currently awaiting approval. Our NPH intern starts May 20th, so breastfeeding community needs assessment and action plan as part of that internship. Diabetes self-management, 5 new referrals. We have support group at the Community Rec Center, chair exercise activity, and retinal screenings are full for tomorrow. We have a lot of people coming for retinal screenings at the health department, and then the diabetes support garden. So we have crops of onions and garlic ready for harvesting when we planted our other bed over there. And Drew over there has been very helpful in planting and putting in okra and all those kind of things, helping us. So appreciate that. Diabetes support group, I'll mention, they had a picture of Miss Deborah and Tom, but they're going to be the instructors for tomorrow. So again, we got a full schedule for the month. So tomorrow is the Spring into Fitness, enjoyable movement and exercise. HR update, we have Lindsay Dickinson, that's a promotion. She started May 10th as a Public Health Nurse 3, and Krishanda Barnes, another Public Health Nurse 3, will start May 15th. We have vacancies, Nutritionist 3, we've done 2 rounds of that, and we are currently working on reclassifying that down to a Nutritionist 2 to hopefully get more interviewees. We have interviews, we've done interviews for a Nutritionist 2, we're waiting on a background check, and then a PA 5, interviews have been set, and then we're advertising for a Public Health Nurse 3 and a 2. With health education update for this month, Youth Development Program, partnership with Triple P, hosted 2 parent nights. One was in January at A.G. Cox, and one was in March at Farmville Middle. The students led parents through a stress calming activity and then an interactive activity on developing a code word to use as part of an exit strategy. This helped to begin conversations around the importance of having conversations regarding expectations of what to do in situations before an event happens. Triple P further enhanced this conversation with strategies to begin hard conversations. And then Tiffany Thigpen partnered with Triple P to teach community resilience model strategies at Keonia to their after-school program with parents. Hoops for Health was also on April 12th, was very successful. Our partners were Greenville Parks and Rec, Greenville Police Department, WellCare, Pitt Community College, the Magistrate's Office, and various departments at the Health Department. Students and their parents learned some valuable information and participated in a 3-on-3 basketball game. And then 57 students were able to participate in the Real Care simulation for a weekend this semester in their youth development program. Students were excited to take home the babies on Friday and even more excited to return them on Mondays, as y'all all are very well aware from seeing those. All the students reported having a greater understanding of the difficulties they would face as teen parents. And then last week, several staff attended the North Carolina Public Health Preparedness Symposium last week, May 6th to 8th in Winston-Salem. One of the big topics there was the new FEMA recommendations that the administration is proposing that will have very significant impacts on how states respond to emergencies and definitely how locals respond, because right now the push is to be local first, supported by the state, and then, if needed, supported by the federal government. Brianna Andrews joined Health Department as a Child Care Health Consultant, CCHC. In this role, she's supported by the Martin Pitt Partnership for Children. Brianna supports child care centers in providing a healthy environment for kids. Valeria Marin. Val's joining the health department as the lead coordinator for Triple P. Triple P is a parenting program that gives parents tried and true strategies for parenting. And Val was also an intern last year with the health department. Nikra Godley, she's the care management for at-risk children, CMART program. Birth to 5 years of age who have long-term medical conditions. They're in long-term stressful situations, have been exposed to adverse childhood experiences, or ACEs, or adversely affected by non-medical drivers of health. Children in foster care and the infant plan of safe care, and were in a neonatal intensive care unit, the NICU. Alexis Daggs recently completed level 2 breastfeeding peer counselor certifications. Breastfeeding peer counselors help mothers overcome common breastfeeding challenges and are part of a supportive community for breastfeeding moms. And then Araceli Angel, she recently became a licensed clinical social worker. Very excited for that. When someone becomes a fully licensed clinical social worker, the community gains a highly trained professional who improves mental health outcomes, strengthens support systems, and contributes to a healthier, more resilient population. About a month ago, I think this was in March, we got to attend the Public Health Leaders Conference, and our own Angie Manning got to present on the panel for Money Matters, Understanding and Strengthening the State and Local Health Funding Ecosystem. So that was a very, very popular panel for everybody that was there attending. So thank you, Angie, for doing that. And then we had a regional opioid settlement meeting back on April. Caitlin Houston's our opioid settlement coordinator, will be presenting our committee's recommendations for the settlement dollars at the next commissioners meeting. But she's also organized, along with the coordinator in Edgecombe County, a series of meetings for local coordinators at different health departments and counties around the Northeast to talk about strategies for spending down those dollars. And that is the last I have. I did also want to mention as an update, I have talked with the consultant. I met 2 weeks ago for our staff climate survey. I got a proposal last Friday, so we're going to be evaluating those proposals coming up. And then last, I'll finish with at the last Board of Commissioners meeting, we had a motion we talked about adding an ordinance for the consolidation of social services and public health. That has been added to the next coming up meeting, so next Monday is where that ordinance will be discussed. Does anybody have any questions about that? We don't have the agenda packet out yet, so we don't have the finished ordinance to be able to look at, but that would be May 18th will be the meeting that will be discussed at.
Thank you, Wes. Anything to add? Question?
I just had two questions. One is, are the fox cases, are the rabies cases, is that normal? And how do y'all decide an animal has rabies? Do you find them deceased and then send them to lab, or how does all that work?
Sure, all over the board. I'm just thinking back MTW, we had a fox came up to a person at Somerset Plantation and started pulling on their pants leg. And so the officer shot the fox, hopefully not the brain, because we have to send that the head off to the state lab and then make sure. So it's either that, anytime a wild animal bites a person, or an animal like a dog or cat that's not been vaccinated. There's different quarantine rules for those, but sometimes we have to send those to get tested at the state. We also have to test things like deer and bear and all that, large animals at the Rollins lab. But usually it's either a dead animal that somebody says was acting strange, and either they have killed that animal, or we go out and pick up that animal and send that off. So usually it's an animal that dogs get after or come after a person exhibiting strange behavior, foaming at the mouth, and then that's sent off for the brain to be evaluated.
In our cases, are those numbers that we have, is that pretty typical?
It's pretty typical. Sometimes we haven't had a fox in several years. So, and last year we had the feline. So that was the first in over 4 years we had a cat. So we definitely look at those to see if there's any abnormalities. But the state publishes every county, every year, every type of animal. So any kind of mammal other than possums can technically pass on rabies.
Yeah, except rodents like rabbits and rats.
Yeah, anything with like low kind of body temperature, so definitely opossums and sometimes bunnies and all that. But over 50% of them are raccoons. So most of the time you're going to see raccoons, but every once in a while you will see foxes. And less typically things like bears, deer. We have seen that, but it's usually Raccoon, then Fox, and then further on down.
And so I had a question also about the ordinance. Is this a fait accompli? Is it fixing to happen? And is there any discussion with the board, or what's fixing to happen?
Well, at the last commissioners meeting, Commissioner Brown asked that it be put on the agenda, I guess, for the next week. And then when we had our workshop on Tuesday, Commissioner Manning asked again about making sure that the ordinance was coming up soon. So Monday, it's on the schedule, as far as I'm aware. It's going to be on the schedule for discussion. To be.
Does that mean it's a vote? And then
It's part of the strategic strategy.
no, but I mean, so is it fixing to happen? What? I mean,
That
yeah.
would be the one if anybody wanted to do public comment, or if any public wanted to do public comment, that it would have to be at that meeting, because it doesn't appear to be any kind of 30-day notice or anything like that.
So if an ordinance is voted up at the meeting, then it goes into effect immediately?
Not immediately, just with an effective date, probably in the future. Right now, the number that I've seen is about October 1st is a guess of a date, because in the time when they pass an ordinance to an effective date, when they can put an effective date in that ordinance, they would say before October 1st, we'd like to have a new board in place, meaning they'd have to approach the Board of Health, Social Services Board, and Trillium to come up with the 15-member board, which would be hopefully the 11 members of the Board of Health, and then additional 4 to 5 members from Social Services Board. That's typically what would take that period over the next 6 months or so.
And that meeting is May 18th?
May 18th, yep. And I believe the agenda and a draft of that ordinance should come out soon. I just don't know when.
Commissioner, what time is that meeting typically? Do you know? What time is that meeting?
6
typically?
o'clock.
6.
Microphone.
Once that gets published, I can send that out,
Yes.
just so we can read the text.
Please do. Yeah.
Wes, maybe I just need to clarify. So that when you use the term ordinance, this would be the document or the guidance that puts this in motion?
Right. Commissioner Brown and Commissioner Manning had asked for an ordinance to be developed since the workshop. Language has been put together, but it's not been completely reviewed, I guess, to be able to publish the complete agenda. But once that comes out, we'll see what the final text is.
And this vote would happen Monday, or is this a reading?
The 18th would be Monday, yeah, unless something changes during that meeting, or unless, anything could be changed, but, it's on the agenda for decision. It's going to be my understanding.
And I presume the letter from the board was duly
Letter from the board was
submitted to the
read.
county commissioners.
Exactly, prior to and submitted and summarized by the manager, and everybody did get a copy of that. But that was right before the vote on the strategic plan several months ago. So they did vote to move forward with the strategic plan, which included that
the
as one of the steps. But the ordinance would be something that would be on the agenda the next meeting, so the full text will be able to be seen, and it can outline a timeline if that's what the board chooses to do Monday night.
And the purpose of this is to save money, presumably? Is that what the motivation is? Is that why the commissioners are pushing for this?
I can't speak for the commissioners.
What's the
but,
motivation? What's the reason?
why?
One thing is, some changes would be a switch from the state personnel system to the Pitt County personnel system, which closely mirrors it, but there are some differences there. And then consolidated human services boards, similar to the Board of Health and Social Services, would have the same powers, like local rulemaking authorities, recommend the budget, those type of things. But it would be under it. The main changes be moving from Office of State Personnel and the Board of Health being the hiring, firing of the health director to the county manager. And same with Social Services. Those are the two main differences. But again, I don't know the discussions of the commissioners or the reasoning, around, if any efficiencies with dollars.
Okay, thank you. Any other questions?
For the record, I would just like to say that, the board's been talking about this, seems like more for the past few months.
Yeah, it's
And-
definitely picked up.
And I would say that the feeling from those meetings has been that the board would continue to be involved in helping understand that decision being what we would do, the pros, the cons, and that no decision had been made, and that the strategic plan, the vote for that was that it was accepted. And so it feels rushed and out of the loop. So I just want to say that for the record because of the conversations this board has had with leadership in the county over the past few months. For it to be up for a vote is a bit blindsiding, for lack of a better word.
Absolutely.
Thank you. Any other comments?
And just to echo that, I mean, it seems like they made a decision, we're going to do this, and really didn't appreciate or want or solicit or take into account, that's probably the better word, what the Board of Health was. It seems like it was all one way. There wasn't any two-way conversation or anything. Which maybe it's the best thing to do. I don't know. We just haven't had a conversation, I don't think, about it. And nobody's come to us and said, what do y'all think? Do y'all think we should do this? Which is typically how I think this is a big decision. This is a big deal. And how things like that sometimes work, but I guess not in this situation.
And go ahead, Commissioner.
Did not meet with you.
They did not, no. As a reminder, the letter that was sent to the county commissioners did not say that this board was opposed one way or the other, that we wanted more information, we wanted an opportunity to do more research to see what the impact was in counties that chose to consolidate and to almost do a compare and a contrast before offering a solid opinion one way or the other. I have not heard anything since that letter was submitted to the county commissioners, and I'm not sure if anybody else has heard anything, but I have not. And so I was under the presumption that we would have an opportunity to have a conversation, but seemingly that's not the case.
Remember I said, Ms. Bennett, that you're at the table.
Uh-huh. Yeah, we haven't been invited to the table. You have to know where the table is.
When you submitted the letter in objection, that kind of put you off. That's just my, okay. So,
We didn't object. We said it'd be good to collect some
Right.
data, see
was
what they do
no
in other
opposition.
places. I guess they interpreted that as we weren't supportive, but
I want you to have to continue to talk, to get into discussion.
I believe that was the board's request, was that we have more information
Yeah.
to make an informed decision and not a decision solely based off a consultant or not well-informed. And that was the basis of that letter. It was not to say that we didn't think it was a good idea or a bad idea.
I thought you were gonna meet with,
Meet with.
manager and
There was no conversation. That letter was submitted to the county commissioners, and there was no response from the county commissioners.
no, we didn't send a letter.
Yeah, that would have been the expected response, I think, but no, we did not get that, so,
I don't know if Mike want to speak to. I know I wouldn't. You don't want to be.
oh, Mike, our commissioner would like to hear from you. Would you like to provide some input, please?
As
So I think James Rhodes and the county manager's offices have been kind of spearheading this effort in conjunction with conversations with the Department of Social Services. I do know today the manager met with Sharon Michelle and Wes to kind of preview this, because she did not want this to be a surprise to the board, and also let you know that the 18th would be the day that comment could be received. But again, James Rhodes out of that office in conjunction with the manager has been the one that's been running the project as far as this effort.
Thank you. Any other comments or questions? All right. Hopefully we'll see a few of us there May 18th at 6 p.m. Thanks, Wes.
All right, thank you.
Okay, we have one item under the items for consent, approval of the minutes. So everyone had an opportunity to review the minutes. Once you have, I'll be happy to accept a motion to approve the minutes.
So moved.
Second.
All right, it's been moved and seconded. Any discussion? All those in favor, please indicate by saying aye. Are there any opposed? Are there any opposed? All right, very good. They are approved. Is there anything else that is for the good of the order? All right, then I will take a motion to adjourn.
So moved.
All right. very
Second.
good. Don't need a second to adjourn. We are done. Done. 6:56 p.m.
Building families is the pursuit of places that promise stability, growth, and ample opportunity for the future.
One of the reasons that parents are leaving urbanized areas to come to Pitt County is because of the community that we have here. There are such great opportunities here. Our education system is, in my opinion, one of the best. Our